They're a lot easier, and they're often a little bit slicker or easier to adjust than those cotton woven ones. But gait belt is the #1 tool. Good footwear and a gait belt. That's what I have on the front page of that picture there, because those are hands down your best tools to use there. A grabber or a reacher, you know, the little clipper thing. If somebody has one of those, fantastic. Just monitoring how they use it, because again, if it's somebody that has had a head injury or is elderly, that doesn't have great balance, oh, they're going to use that reacher. That's fantastic. And they look down, they're going to lose their balance, right? Or if they more so than looking down, if looking up, they'll lose their balance, right? So if they're sitting in a chair and they're going to reach something up there and they look up, they might go over. So grabbers or reachers are great, but they have a lot of limitations, and people tend to think that they can pick up things way heavier than they should. So just really be, again, awareness, right? So if there's somebody and they're using their grabber or their reacher, just kind of notice what they're trying to go for. Let them do it, right? The more independent you can let them be, fantastic. But if you're like, I'm not so sure that's going to work, right? And then maybe, you know, say something or step in. Grab bars, bed rails, right? Just being aware if there are any in the household, where they are, how you can use them, how they can support you. And then obviously a cane or a quad cane. You guys know what a quad cane is? Yeah, so it's the cane that has the 4 prongs on the bottom. They make these ones that have like, that are the wobble bottom, that are like kind of 3 little surfaces like that. I think you got to be a real special person to use that kind of cane. It's for somebody that walks on uneven surfaces. A quad cane is fantastic, and it really is way more stable. The other thing for some people is walking sticks. So I brought some walking sticks today. Just to show you. They're adjustable, right? They're fantastic. My dad had a partial foot amputation, and then it took him a year recovery, and he came out to visit, and we went to Glacier, and it was the first time my dad was going out to do something. And we brought walking sticks. He's like, I don't need those. I learned how to walk without, you know, and I'm like, I think we're going to use some walking sticks, Dad. And he was so happy to have them, because it just made him way more confident, right? So walking sticks, similar to a cane, right? You can use one or you can use both. This does not want to stay stable for me for some reason. There we go. And adjusting to proper height, right? So this one is actually a pretty decent height for me. This one is too high, but it depends on the surface that I'm going on, right? Using 1 versus 2, same thing with a cane. You know, some people actually use 2 canes. I don't know if you've have any experience with that. I think it's nuts, but that's not my call. That person wants to do that. So again, just being aware of what is their preferred assisted device, what they're using. And if somebody like, absolutely, I'm not old, I don't want to use a cane. Walking sticks are sometimes a really great little tool that you can use to kind of replace the idea of a cane. Yeah, and then obviously walker. We got 2 different kinds, which is fantastic. I put a few different ones in the photo there, right? So you got kind of your classic folding walker here with the little wheels up front, so you can push it instead of the old kind that never used to have wheels and you had to pick it up, right? And then you've got a four-wheeler here with brakes and the seat, right? And I think we see a lot more of that for anybody that needs a walker from a permanent perspective, right?
Think about the ones that are advertising, you know, where the walkers, where
their hands come up real high. Yeah, I think it depends on the person and what their needs are, right? And what other limitations they have. So, and you know, and as a caregiver that's helping out, you guys might be the first person to notice something that a change in a person's status, right? Yeah. So if somebody's arthritis is just getting really bad and they're not able to do this anymore, you might be the first person that can see them struggling with that. So then indicating that to their family, to their doctor or whatever, like, hey, it might be time to reevaluate that, because then you can get the walkers that you can actually put your forearms in. Right, and that works great, and then they're not having to grip things.
It makes sense because, you know, when they're bent over, you know, the back starts to bend anyway.
Sure.
So this kind of keeps them
it keeps them straighter up. That's true. And the other thing is, no one should ever bend over to use a walker. If they are, they're not using it the right way. Right. So if they're here, okay, that's not right. You should be in the walker, and your hands should be there. right? And you should be walking because look, it's clear, your foot can go through, right? So that's kind of how walkers are meant to be. So yeah, so paying attention. And again, if something doesn't look right, like you're not the PT, you're not the OT, it's not your job to go in and try to train that person on it, but you can bring it up so that that person is safe by saying, I think we need to have you reevaluated. Maybe let's talk to the family about that, right? So that's important information, right? So you've got walkers, that's one progression, and then we move to the dreaded wheelchair, right? And there are so many different kinds of wheelchairs. So I included just a couple of photos of the different types of wheelchairs on there. You've got a standard wheelchair. This one's pretty close to standard wheelchair. You know, that's got not a lot of versatility to it, but it does fold. And you got the leg rests that can spin around. And then other thing too is that I don't know what this thing's for. It's for a drink or something?
It's supposed to go inside.
Go back into the hole. I think it
The
lifts
hole
up.
underneath here.
Oh, gotcha, for the leg. Okay. Yeah, so, you know, each one's different. So,
Oh, it's so frustrating.
well, here's the thing, right? Like, so you're going over to, you know, a family that has hired Touching Hearts at Home for you to be their caregiver. That is their responsibility to instruct you how to use all of the things related to the patient that you are there to care for, right? I'll tell you this. I know a lot about this. I don't know anything about babies. When I have to babysit, like for friends, I don't know how to put a kid in a car seat. I don't have any children. I don't know how to do some of this stuff. So, and one of the things that's most frustrating for me are those umbrella strollers. I have no idea how to fold them up, how to get them out to make them stable or whatever. So whenever I have to take care of somebody's kid, I'm like, you got to teach me all this stuff. I can change a diaper, but some of the equipment for babies, I have no idea. So it's the same thing. And every single wheelchair and every single walker is different, and how they use it is different. So making sure that you're getting that proper instruction from the family or from whoever it is that is bringing you in to help the person, they need to really instruct you, because
What's that right there?
this is just,
Oh,
it needs
it's
to
not
go in there.
supposed to be
Yeah.
You kind of have to
Look
lift
at
it
this
up,
side.
and it goes in a.
It goes inside this tube. So it has to do with the seat here,
Fold it.
right?
Oh, okay.
Let's see if I can.
Left it in my car, and that's,
Let's see if I can get it to go in there now. There we go. But it feels like it's maybe a little bit bent inside there. There we go. Now it's in there in the right spot.
Thank you.
Okay. Yeah, so there's wheelchairs. And then what I didn't bring today, but a few things for you guys to be aware of, are slide boards. Slide boards are super duper duper helpful. And it's something that I encourage a lot of families to get, and people think that I'm crazy, but they're really, really useful. And it's basically like a flat piece of wood or plastic that goes from, you know, if somebody's got to go from sitting on a bed into a wheelchair, the slide board, you just slide their butt down it, right? So what I used to keep in the clinic, because I don't work with a lot of people in wheelchairs, I just literally had almost like a 2x4 piece, and I put it inside a plastic bag and taped it. So it was slick, they could slide up and down it, they weren't going to get any slivers or anything, and it worked fantastic for the handful of times that I needed it. But slide boards are great. They're a really useful tool. And then you guys have probably seen them now, if not advertised, if nothing else, those recliners that are lift chairs, right? You can go in there in the recliners, and then they can just help get the person up. Those are fantastic. What a great invention, right? So the one thing that I will say is a recliner is not a great place for somebody to spend a lot of time, because they're very unhealthy for you. But again, not your choice. But if there is a lift recliner, use it. Don't torture yourself trying to get somebody out of a chair. If there's a button that'll help them stand up, that's going to make it way easier for you as well. So the lift recliners are fantastic.
Yeah, one downside to them though is you have to make sure that their legs are strong enough, because they'll want to, as the
They'll
thing
slide.
Up, they'll slide right.
That's
right off.
exactly right. That's exactly right. So, and we'll go over that in a minute with the gait belt, like transferring somebody. Your knees need to block their knees even with that, right? Even with that chair. And then the other thing too is some of them are swivel, right? And then it might start to spin on you or whatever. So sometimes actually for any kind of a rocking chair or a recliner or a swivel, sometimes wedging something just underneath it so that it won't spin or so that it won't rock can be really helpful. So again, just being prepared so that you kind of know your surroundings and know the situation there. And then, you know, obviously there's a shower chair, there's a tub transfer bench that are out there. The toilet seat risers, man, if they don't have one and you think that would be useful, recommend it right away. It's a game changer, a really big game changer. A toilet seat riser.
Oh.
Yeah, that's huge, right? Those toilets are so stinking low and they're so slippery, right? Trying to get all the way down there is really tough. So, and even better, now they have some of those toilet seat risers that have little handles on them, just great. Unless you're transferring out a wheelchair, you don't want the handles. But otherwise, they're really helpful. And then one of the other things I put on there was a Hoyer lift in case you guys come across it at somebody's house. So Hoyer lifts are complicated, but not. They're a very simple concept, but each one's a little bit different. Operating them, getting people in and out. I think that most of the time, in my opinion, a Hoyer lift is a 2-person job.
Definitely. And in our company, we won't require that to be a 2-person.
Yeah,
That's
okay,
a
good.
requirement from my standpoint.
Correct, good. That's good, yeah.
Yeah.
Yeah, because they're tricky and you,
Weight distribution.
yeah, and you just don't want to hurt somebody, right? So, yeah, so that's basically the little pictorial there is of all kind of a few of the different types of things that are out there as a reminder for you. And then,
But it doesn't have everything, so just send me
Yeah.
the whole thing.
yeah, I'll give this to you when we're done here, and then I'll email all this to you. So a couple things that we're going to go over, just some gait belt transferring from the bed, from this table, into the wheelchair, into a regular chair, transferring from one chair to another, using the walker, walking, standby assist, that kind of stuff. So we're going to go over all that. It's going to be pretty quick. A few things is plan ahead, right? Like if you know this person that when you're there, and I don't have any idea what your shifts are, how long you're with somebody, or, you know, everybody's situation is different. But if you know that at some point in time, you are going to assist this person to walk down the hallway to the bathroom from the living room or whatever that is, kind of have a route in mind, a plan for what is the equipment that I'm going to need for that. Can you get anything set up ahead of time when you first arrive at somebody's house? What can you do to make your life as a caregiver easier, but also safer for you and safer for that person, right? Make sure the lights are on. You don't want these dim environments, right, when you're moving them around. Throw rugs are like the #1 hazard of all human beings that are inside. So if they have a lot of throw rugs and you know, oh, we're going to have to walk down this hall to the bathroom, just move them out of the way while you're there at least, right? Like, makes a big difference. Educate them why they should not have throw rugs. I argued with my grandma for months about throw rugs. And then finally she got it, I think after she tripped on one time. But yeah, and again, just debris. I mean, there's a lot of like crazy hoarders out there and people with insane amounts of stuff, and you gotta like have a little trail to get where you gotta go. So just really paying attention, because things might have changed since yesterday when you were there. Something might have fallen over, something might have broken, might have been a leak somewhere, and now there's slippery floor and nobody noticed it. So every time you get there, really scan the environment, look really, you know, what am I gonna need to do possibly today with this person, and how can I prepare ahead of time to make sure we're ready for it? Do you have something to say, Ryan?
Yeah, it was just with the throw rugs is another thing that a lot of people maybe don't think about is that I have clients that really love their throw rugs, and so when I'm like, well, you're gonna trip over them, they're like, well, we're just gonna put down more tape, like the carpet tape.
Yeah.
But that leaves sticky residue behind it.
Yes, that's right. So even if you move the throw rug, you got sticky residue that will trip you up.
Be careful, yeah. So you can trip on it, or their foot will stick to it, or other issues that could happen. So just be aware of that.
Yep.
Think,
And
I just grab it, move it, and then transfer them, and then you're like, wait, oh, I tripped or something, or
yeah,
and
having conversations like that with the family members, right, can be useful. And you can also make it about not necessarily even about the patient that you're taking care of, but about the rest of their family, right? Like we had to do that with my grandma. And my grandfather had a fall and he broke a couple of ribs, and then he was in a rehab center for a little while just because my grandma was half his size and she wasn't going to be able to help him. And she just always had throw rugs, and we wanted to move the bed in their bedroom to a different wall so that it was really close to the bathroom there, because they were in ensuite. they've had their bed that way for 60 years. They were married for 67 years, right? But we're not moving the bed. And I'm like, well, and then they each had a little throw rug for when they got out of their bed with their little feet to go on, or whatever. And my grandma was just so adamant about not having it. Like, Grandpa might trip and fall and it'll kill him this time. Right. And, you don't want to be that blunt, but sometimes those are the conversations that can be most, effective, right? Yeah, that will stick with them the most. Scare the shit out of them. That works great, right? Anyway, so kind of having that plan, that action plan, and then preparing ahead of time for like in the environment. Like, okay, the bathroom is down that hallway. I know she hasn't been in the bathroom for 2 hours. I'm just gonna go turn the lights on in that hallway ahead of time, right? Like, so just again, so that you're kind of prepared for that stuff ahead. If there's anything that you haven't done, you're in a new client's house, let's say, and you haven't, oh man, I haven't had to use a walker in a long time. Go and watch your little YouTube videos, a reminder of how to do that, right? Or look it up or ask for help. Honestly, you'd rather like, hey, I haven't used this kind of wheelchair before. Can you show me on this one, like what the trick is? Because the other thing too is that it might be a standard wheelchair, but something might be broken on it. And you don't know that, right? Oh, the brake on this side doesn't work very well, right? And now, and the patient usually has no clue, right? So another thing you might have to point out to their family or to their PT or OT or whoever's coming around, right, to help out as well. So just really kind of getting to understand that and reviewing any of your training that you need to be reminded how to do things, I think is really helpful. And then also just gathering, like being prepared by having the tools, right? Like, okay, I arrived here, the family was here, and now it's my turn to be here for the next 6 hours or whatever. Like, where are the different tools that I might need for this person? Where's the gait belt that they normally have? That she's not wearing the gait belt. I don't see it on the table next to the sofa. Where did it end up, right? So you might need to just go searching for some of the stuff that you're going to need, or ask for it. Again, if you arrive and somebody's leaving, hey, where's all the equipment that I might need today? Where's the gait belt? Where are her slippers? Where is, like whatever else you might need. So just kind of gathering that and having it nearby and ready. And then again, adjusting anything in the surroundings that might be, might interfere with you. Because again, you might go every day, and somebody might have just adjusted something from the day that you were there, since yesterday. And you might just need to change it again, right? At least for when you're using it. And then obviously communicating with the patient, right? Making sure that you are, letting them know like, hey, I noticed this, like, or whatever, or do you need to go to the bathroom? Let's go do that, or whatever it is, right? Communicating with them, asking them for permission. For everything, making sure that you're clear and concise, that you're getting their permission, that you're getting their feedback, that they might want to do things a little bit different, again, coming to an agreement, a compromise, whatever, before you actually go to do any of the transfers or movements with them. And then getting set up. Okay, you have to go to the bathroom. We are going to move you from this chair into the wheelchair to get you down the hall to go to the bathroom. To do that, I need to make sure your shoes are on. I need to make sure the gait belt is on you. I need to get a slide board ready. So just getting everything actually set up on the patient as well. And I would highly recommend that you talk through it. That every time you do it, that you are saying that to the patient. I'm going to put the gait belt on you now, okay? Can you lift up your arms? I'm going to come across, why you're doing it, because they might have forgot, right? Or they may not have that cognitive function for that. So just every single time, okay, I'm going to put your shoes on now so that your feet will be not slippery on the floor when we go to stand up and pivot, right? So just reminding, so kind of step by step, actually saying to the patient what you're doing as you're preparing with that. And then again, you want them to feel really safe with you, and you want them to be confident that you know what you're doing, that you're not going to hurt them, that you are doing what it is that they need. Okay, I am going to take you to the bathroom now, right? I'm not putting you in the wheelchair to sneak you out into the car to go to a doctor's appointment you don't want to go to, right? Like we do with the dogs, right? But just being, you want them to trust you, you want them to feel safe, you want them to feel confident in you, and you need to feel that way about yourself too, right? So making sure if there's something that makes you feel uncomfortable, you're not confident with the situation right here, redo it, reorganize, call somebody if you need to, but you need to feel safe and confident with what you're doing for yourself, but also for that patient, right? So making sure that that's there as well. And then, a couple other things I just have here. A firm surface and support, right? Like, so again, kind of comes back to those throw rugs or whatever. If you need to use something besides your body weight to help or assist them, just making sure that you're not going to push on something that moves, right? Again, that recliner chair that swivels, you need to block it so that you're not trying to move them and then the chair falls over or whatever, right? So making sure that you're moving from one solid place to another solid place and you have the support that you need for that. And then when you're doing something as hard as it is, and you may have done it 50 times today, you need to be focused on what you're doing, right? It's so easy for us to be in conversation and we're so used to, we're just gonna move right now. And we're talking about your grandkid and we're just doing this because it's a habit, right? That's when stuff happens. So trying to stay focused, and that's why I say out loud the step-by-step thing that you're doing. And so if you're in the middle of a conversation, you say, you know what, we're going to stop right now. We'll keep talking about your grandson when you get back from the bathroom. Right now, I'm going to put the gate belt on you and we're going to do this. So just kind of really being focused with what you're doing and being very deliberate and clear about the actions that you're taking with them. Really, really important. And then fully execute. Right? Don't okay, they're standing, they're pretty good right now. I'm going to pull the wheelchair over and then they fall down, right? And don't assume that they are safe until you are completely done with that activity, right? And never, ever, ever turn your back until they're fully adjusted in their new location. That happens, and that's not even just with elder care or people that are, I worked in sports for a long time, and there was this huge lawsuit because a kid got injured outside on the playground. Athletic trainer brought him in to assess their injury. Kid walked in, was totally fine, sits down on the edge of the treatment table like this. The athletic trainer turns around to go get some tool to use with them. The kid passed out, fell down, and then ended up with a broken collarbone when they fell on the floor, right? And the kid was conscious when they walked in, but ended up losing consciousness. So you just never know. So I'll never turn your back on somebody until you're fully aware that they're safe, right? And then again, complete the action. Everything's fully done. We're complete. Okay, great job. I'm going to now take the gate belt off of you, or I'm going to put the wheelchair away, right? Now we can go back to this conversation that we were having, right? Or whatever that is. So just really complete that. And then you can ask as well, oh, hey, was there anything that I did weird or that was funny? Get feedback from the person, give your own feedback for you to them. Hey, you did a great job. Next time, let's just see if you can turn your foot a little straighter when you're walking or whatever, right? So, and immediate feedback, because if you wait and don't tell them till later, or if you don't ask them till later, it doesn't compute that it's for that activity. So you want that immediate feedback. Okay, we got you standing, you're in the wheelchair. Are you comfortable? Are you okay right now? Is there anything that we could have done different in this step? Now we're gonna go down the hall, right? That kind of stuff. So really getting that feedback as quick as you can, right? So those are just kind of some important action steps or how you do that. And I just put a few examples of some video references on here, and I think you guys have some of your own training things with Touching Hearts at Home. There are a few YouTube channels that just have really great videos for reminding you how to do some of this. So I put a few of them on there. Bob and Brad is some of my favorites. It's just two physical therapists, and they have all kinds of amazing things on their YouTube channel. And so really, they're a great resource. There's an OT that does one called Equip Me. And she does some training on there. And then there's one that I don't think is as good, but it's a little more practical for family members that are caregivers, called Senior Safety Advice. That they have a YouTube channel. There's the Adaptive Equipment Corner. That's more about teaching you about the newest assistive devices that are out there, but they do show you how to use them and how to do some of that stuff. That's a couple of physical therapists. And then For Your CNA is actually a CNA training company, but some of their videos are really useful. So there's just some of that out there that you can reference. And honestly, I don't use YouTube. I'm not a fan of many of their policies, but people put everything on YouTube, right? So it's I think it's the #2 search engine right behind Google for people looking for stuff. So you can just type in there as a reminder, oh, how do I use a slide board, right? And 10 videos will pop up and you can kind of watch and get a sense of that. So I was doing that earlier today to come up with some videos for you on YouTube, right? There are things you don't have to pay for. There are information that's out there. So does anybody have any questions or anything that they want to talk about specific to these things? There's your copy. Okay, let's do a little practice and some scenarios here. So I'll move some of this. Oh, one other thing that I brought two other things that I brought. Here, Roy.
Got it.
The shoehorn is an amazing tool. If the person that you're doing caregiving with doesn't have one near them, it's a really nice present. Find out if they have one, the longer the better, because then it's a lot easier. And and if it's somebody that you might actually be helping them to don or doff a pair of shoes, it's really useful to have one around. So I kept these around the clinic. I have one by each door at my house. I will tell you, I very rarely use them, but every once in a while they're nice to have. So shoehorn is great. And then this is TheraBand. This is rubber. When somebody is slippery and you can't get a good hold of them, having a little bit of rubber is helpful, right? So TheraBand is a great thing because you can use these for a lot of different things. The other thing that I brought was from my kitchen drawer, the jar lid opener, right? So, or a lot of times the shelf liner is kind of that rubbery stuff too. So just having a small piece of rubber that you can use to help with gripping things is really amazing, right? So whether it's some of this or one of these kind of things, super useful. So kind of keeping that in mind as some other potentially useful tools. Gripping a body part, absolutely, or gripping, something that's slippery, or whatever. It's amazing what you can use it for. And then just reminds me also, clean, dry hands before you go to do anything. Their hands clean and dry before they go to grip onto their walker. Right? So clean, dry shoes as well, or the bottoms of their shoes, right? So just making sure that you've got that. And then anytime you're using any equipment or you're touching them, especially if it's an elderly person, their skin is so frail. So you want to make sure that there is a layer of clothing between anything like a gait belt and their skin. And the same thing if you're just holding their arm or something. If they're in short sleeves, be really cautious of how you're holding or gripping them, because that skin is so fragile. And man, one skin wound can literally lead to death for somebody. So being really careful with that. And not necessarily just for elderly, anybody that has decreased sensation, right? So even if it's a neuro patient, post-stroke or paraplegic or something like that, their skin is really vulnerable. So, okay. So I want to go over just sit to stand with a gait belt, and we're going to go with a chair with arms, which all of you are sitting in, and we're going to go over a chair that doesn't have arms, which is why I pulled that one over there for Sherry. And then we're just going to start with that, kind of reviewing that, and then we'll go transferring from bed to wheelchair. And then also using a walker to do a transfer versus a gait belt, and how that is. Okay. You guys need a quick break or anything? You good?
Well, I thought before I forget again, I just wanted to give another tip for other caregivers. I had a client that had really bad, if he's having bad eyesight but doesn't want to have you read it for him or something like that, they have just like Walmart has these like little things that fit in your pocket. And it's a little
magnifying glass.
So if like he's trying to punch in his code for like
a phone or something,
or whatever, it's like, oh, look at you only entered in 3 things, 3 numbers for your pin or something like that. Just like that helps a whole lot.
Yes.
That you're just like, all right, if I just had a magnifier,
Right.
And it's like
keep one in your pocket. So yeah. Good for you, Ryan. I think when if you really, and I think the thing is, you fall in love with your patients, right? Like you want to take care of them, you want to help them, you care as much as your family does. So having those little things can make a huge difference, right? And especially if it's something you can fit in your pocket, right? Even if it's a hanky, right? The wet wipes if you need them for cleaning them up, or the little magnifier. But a gait belt, I would recommend that every family that you work with has one, even if it's not something they're currently using. They have it if you need it. I would also recommend that if this is your career, that you have one that's yours, that it doesn't necessarily even belong to Touching Hearts at Home, or that you have one for yourself, because it can be a lifesaver literally when you got to pick somebody up off the floor.
We're not picking them up. We call 911.
Do you? Okay, great.
Yeah, we do not.
Okay, great.
Now, the caveat is if they've got dementia and they jump right up and they're going,
Yeah.
then obviously we don't need to call 911.
Right.
So it's a case-by-case basis.
Right.
They call 911, then they call us. That's how we do it.
Okay. Okay. All
They're
right.
in the community, so it's like being like at a doctor's office. They call 911.
Right. Right. Okay. All right, that's good to know. Yeah, I had my friend, I was just in California last week, and my friend, she used to play professional tennis. I worked in professional tennis for a long time. And she was telling me she went to the doctor's office, she just had a dermatology appointment, and she's walking in Kaiser Permanente and whatever, San Mateo, California. She's walking into her dermatology office, and she sees a woman wheeling another woman out in the wheelchair. And the woman that was wheeling the woman in the wheelchair, she said was like 5 feet, 100 pounds, right? And the woman in the wheelchair was obese. And she wheels her up to the car and opens the door. And then this little woman is trying to get this obese woman into the car. And she can't, right? And so pretty soon this little woman has this big woman basically on top of her, and she starts screaming for help, 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 right? So my friend is like, runs over there and is like, what are you doing, man? And then trying to help. So my friend, who's a big, strong, ex-professional athlete, ends up having this obese woman. She's holding her up like this, and she just can't. She was telling me how mad she was at herself. I couldn't lift her, Nadine. I couldn't get her into the car. So she was there for like 5 or 6 minutes. Now, Matt, like just right now, my quads are burning, and I'm not even holding anybody, right? So she was trying everything she could to not let her fall to the ground. I said, the best thing you could have done is set her on the ground and gone and got help. And she said, well, after 5 minutes, that's what we did. I told the other woman to get the wheelchair out of the way. We laid her down in the parking lot, and then I went inside to go get help, right? And interestingly enough, the hospital right there said, we don't do that.
Yep.
And she,
Out in the parking lot.
yeah.
Tap out.
Well, and there it was. You don't help this patient out, and so you're gonna have this other person unsafely do that, right? Like it was crazy. But so then I was treating my friend, the tennis player, for having a sore back from trying to help somebody in the parking lot. So yeah. All right. Who wants to be a patient?
Okay. I can do it.
Perfect. Let's pull your chair forward a little bit.
Oh, okay.
Mm-hmm.
All right.
Great. Okay, I'm gonna have you turn the chair. That's perfect.
That way?
There. Then how is that on the video for you, Jerry?
Yep.
That's on there. Okay.
Yep. And I can.
I'm gonna have you take your coat off for me.
All right. Sounds good. Hopefully not anything too distracting.
No, much less so my. Do you have your own belt on?
Yeah.
He does. Okay, so you can use a gait belt or you can use their belt, depending. Gait belt's a little bit better than their belt, but when in doubt, you got their belt. So gait belt actually isn't meant to go around their waist; it's meant to go around their chest, right? That gives you a little bit different leverage as well,
Yeah.
right?
And yours is a lot better because yours is leather and it's got with the holes in it. So in order for yours to fail, it would actually have to rip. This one is a ratcheting belt, so it's got a little mechanism inside.
Right.
And so if you took my full weight on it, that mechanism would probably slip.
Right,
So,
right. Well, there you go. Belts. Even their belt might not be good enough, right?
Yeah.
You could end up unhooking it. Yeah, exactly. And yeah, the little loops of pants could also tear as well, right? So
oh yeah.
it's a great backup, but it's just not your number one choice, right? So gait belt usually depends on the person, right? I usually ask them to sit tall.